Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, good afternoon, good evening. Each welcoming according the region time for each country. First, I would like to thank the Arab Turkoman Foundation in cooperation with the Translators Union and the Bioscience Research Support Foundation for this kind invitation as a speaker at the Scientific Translation Conference to develop research skills and sample science. This is with a strategic partnership from the IFAD platform and with a media partnership with the Investor Time Foundation and sponsors by the most famous institutions and platforms in the Arab world in the field of training. Today we will discuss the very important talk about enhancement of mental health post-COVID-19 by Assistant Professor Wafa Osman, Head of Psychiatric Mental Health Nursing, Faculty of Nursing, Helwan University, Egypt. First, we will know what's the learning goal that is wanted to outcomes from the sessions. As we see, first, the participant to have increased understanding for one, understand the scope of post-COVID-19 condition, two, be able to identify different sequences of post-COVID-19 condition, three, understand the linkage between disaster and psychological mental outcomes. Finally, describes the health way to deal with the post-COVID-19. According World Health Organizations, more than 5,004.4 million confirmed COVID-19 cases at the 20 April 2022. Over 6.2 million related deaths had been reported to WHO. Approximately 1.2 million new cases were being reported every 24 hours in early 2022. But this has now decreased to about 4,000 during April 2022. Introduction. Most people who develop COVID-19 fully recover, but current events suggest that approximately 10% to 20% of people experience a variety of mid and long-term effects after they recover from their initial illness. These mid and long-term effects are collectively known as post-COVID-19 conditions or long COVID. It is important to remember that our understanding of the positive COVID-19 condition along with COVID-19, researchers are working with patients who develop post-COVID-19 condition to better understand more about its cause and symptoms. Also know about its effect for second illness taking for the same individual. Now we want to know what is meaning of COVID-19. Post-COVID-19 condition is defined as the illness that occurs in people who have a history of probable or confirmed SARS-CoV-2 infections, usually within 3 months from the onset of the COVID-19, with symptoms and effects that last for the last 2 months. The symptoms and effects of post-COVID-19 condition can't be explained by an alternative diagnosis. Now we will know what is the common symptoms of post-COVID-19. As we see, the individual who suffering from the post-COVID-19 may be suffering from different symptoms as depression or anxiety. It is very important signs and symptoms should be dealing with it, because depression and anxiety may be causing the other symptoms that deteriorate the condition. So the mental health play vital role to deal with these symptoms, to avoid the complications, to avoid the severe symptoms of depression as suicide and suicide attempt. Also, from the symptoms, persistent cough, fever, chest pain, loss of smell and taste, fatigue, shortness of breathing or difficult breathing also, trouble speaking, muscle aches, memory, concentration, or sleep problem. People with the post-COVID-19 condition, also known as long COVID, may have difficult function in everyday life. Their condition may affect their ability to perform daily activity like work. Now, who is at risk? Anyone who becomes ill with COVID-19 can develop a post-COVID-19 condition. Post-COVID-19 condition is being studied by many experts around the world, and our knowledge and understanding of post-COVID-19 conditions are growing. Current research shows that approximately 10% to 20% of COVID-19 patients go on to develop prolonged symptoms that may be post-COVID-19 condition. There doesn't appear to be a relationship between initial severity of COVID-19 infection and the likelihood of develop the post-COVID-19 condition. What is the sequences of COVID-19? As we know, COVID-19 may lead to severe stresses, and stress that lead to different signs and symptoms that affect the human life and the general health of the human. Like that, sometimes cause the following. Stress may cause fear and worry about your own health and the health of your loved one, your financial situation or job, or the loss of support service you rely on. Changes in sleep or eating better, difficulty also in sleep or concentration, worsening or chronic health problems, worsening of mental condition. Mental health condition, it is very important to man. You should deal with it in the positive way to avoid any complications or subsequence that is related disturbance in mental health condition. Also, from the sequence of the stress with COVID-19, increased use of tobacco and or alcohol and other substances. That is, maybe some persons may deal with the problem faced by negative behavior or negative attitude to deal with the situation. It is way to escaping from the reality, and it is unhealthy coping mechanism to deal with the problem that face. What else sequences of the COVID-19? Also, we can find psychosocial stressors with COVID-19. It is common and normal for individuals to feel stressed and worried in response to any disease outbreak. Specific stressors particular to the COVID-19 pandemic are misinformation that is will be received from social media, and the social media maybe give information from unspecific or specialist related to this problem. Closure of schools and children's activity spaces, travel restrictions, possibility or actual physical isolation and quarantine, deteriorations of trust in government agencies and social networks, avoidance of health facilities to avoid infections or severity of infection. It is maybe in some time rationale for the people. Risk of relapse in pre-existing health condition, including mental health. Common symptoms of other health problem can lead to fear of infection, fear to transmit infections to another one, especially loved one. Also from the sequences of the COVID-19, social stigma. Discrimination toward the person who have been infected and their family members. Social stigma toward this treating and caring for patients, caregiver or professional frontal line that give the care for the patients with COVID-19. Social stigma toward a specific ethnic group, population group, nationalities. It is important to give hint about healthcare professionals and frontline workers. It is essential that preventive intervention should be taken and educate for the healthcare professional on the several behavior strategies that can be followed for coping with stress by implementing psychological intervention services that offer mental support application. Also give regular monitoring for the mental health illness and providing early support for health care professionals. Also, it is important to conduct group discussions to help the staff members openly talk about how the epidemic is affecting their work and identify factors that cause stress. In addition, an anonymous online self-checking tool should be available for staff members at all institutions that provides the care for patients with COVID, to providing automatic tolerate feedback for healthcare profession according the actually condition they have. Now, we should know how to protect yourself from post-COVID-19. Protection against post-COVID-19. The best way to protect yourself against post-COVID-19 conditions is by doing everything you can to avoid getting infected with the COVID-19 virus. That include keep physical distance of at least 1 meter from others, wear a well-fitted mask over your nose and mouth, open windows to change and exchange the fresh air, cough or sneeze into your elbow if you haven't any tissues, clean your hand frequently by soap and water or alcohol, get vaccinated as soon as it is your turn. Vaccinations is very important to reduce the severity of the symptoms if you have any infected COVID-19 virus. And vaccine also shortening the time of the signs and symptoms you have. Also limited and restrictions the course of infections from one to another in the member of the family who have the certain one have COVID-19. Now we should talking about what is important to do. It is important to find hope, safety, empathy, social connectedness, especially for the expert or psychosocial therapist, and also community efficacy should be embedded across every intervention. It is important. People with mental health, substance abuse, or psychosocial disabilities, it is important, need continue uninterrupted access to care and support during outbreak of the time of COVID-19. Also, enhancing the knowledge and confidence of primary health care physicians in treating this prevalent mental health disorder is one of the most effective ways to address this problem. All healthcare professionals should be encouraged to participate in a special training course. It is very important on emergency psychological care and the first aid for psychological status prepared by WHO and other organizations. Now we will discuss about mental health, psychological, social support intervention. To deal with post-COVID-19 should be first carry out clinical psychological intervention. We will discuss what is the ways to deal with the suffering person from post-COVID-19 by psychological intervention, provide psychological support to facilitate emotional express. It is very important to express emotion, especially negative emotion for internal feeling. Provide emergency care and psychological first aid. Identify with previous psychiatric condition like depression, burnout, anxiety, bipolar, trauma, and so on. Identify with secondary psychosocial risk to work, chronic disease, young children or elderly family members, difficult in transportation. Identify who needs special attentions. Provide initial care and refer for longitudinal follow-up if necessary. Provide psychological counseling. Psychological counseling may be face-to-face for specialists, or nowadays we found some types of platform give counseling, psychological counseling online clinic. Develop strategies for managing anxiety. Develop strategies that promote empathy and through therapeutic groups. What is the principles or what are the principles of providing mental health, psychological, social support? First, primary focus on physical and material care and protections people from danger. Immediately interventions, be direct, active, and remain calm, focus on the here and now situation. Here and now situations, it has the strategy we were talking about it, how to do to deal with the psychological problem or anxiety and depressions in the later slides. Also from the principles, provide accurate information about the situation, recognize the importance of acting, be honest with family members, focus on strengths and resilience, encourage self-reliance, respect and feeling of others. It is important. Don't give false assurance, because if you give false assurance, you will miss the trust from others. Also, stone is composed of hydrogen and helium. Provide and ensure emotional support. This principle needed special skills to deal. What is the skills? What are the essential skills needed to deal with the patients or anyone have post-COVID to have success outcomes? You should have listening skills, and listening skills have the certain criteria, because listening skills give the sense of importance. You can help him. You here to give the care needed according to the condition, and other importance of listening skills. Communication skills, and it is important to deal with the others with two ways of communication, with methods verbal and non-verbal communications to be more effective and you have ability to give accurate message. Politeness, patience, it is very important. Caring attitude, trust, honest, kindness, reliable, accountable, approachability, empathy. Empathy, it is important because it is professional skills to give the care in the right way. So you should be use empathy and avoid sympathy. Non-judgmental approach, commitment, not taking advantage of vulnerable people. We should be talking about also what is the role of the parent or caregiver to maintain mental health. We found it is important to promote an environment where children can grow up and develop their full potential by having fun and being safe and healthy. Also, it is important to facilitate a space where child are listened to. They can express their thought and feeling, despite the feeling is negative. It is important to react and express internal feeling and are free to ask any question and are answered honestly. That is some example of mental health as a first aid. First aid person who help others to deal with the psychosocial problem should be have listening skills with professional level, give support on professional level, professional help according the knowledge and practice he training and taking different and several courses about how to deal with the other person needed for psychological support by professional help. Don't judge. It is the judgment. If you have this manner, it is will be cutting the ways of communication between you and the person needed to help. Three steps to mental well-being. To have the mental well-being, you should learning some strategies like mindfulness. Mindfulness is one of psychotherapy and strategies. We learn it by different ways, like you in mindfulness you find different strategies you use to deal with stress, with anxiety, with depression, like body scan, like light yoga. That is meaning you concentrated for the now. You concentrated your feeling, your cognitive for this moment. Some of these strategies like body scan, you should be sitting in open area in relaxed position and close your eyes slightly. Then you should think about this situation we have now. What is your feeling now? And there are some other strategies like testing the eating. All of us eat the food spontaneously without testing it. How you test the food? How when you take a piece of sweet, you should be concentrate your thinking when you put it in the mouth. You will check the size of it, the taste of it, the smell of it, the hardness of it, the ways of movement of this bite of sweet in your mouth from right side to left side. You concentrated your thinking and feeling on the one thing in the moment. So you can change your ways of thinking, your mood. It is different about meditations. Mindfulness have the different strategies. It is short notes about it. Also from steps of mental well-being, connecting for professional one who trained to deal with psychosocial problem related post-COVID-19. Be active. From the ways to have mental well-being, you should be active in your life, daily activity, update yourself, connect with others, make relationship, work with the team, have responsibility according to your ability, learn new coping skills to deal with different situations in your life. Also, it is important to take benefit from rest and sleep. It is important to take the importance for your general appearance, and so on. Purpose of providing psychosocial support. Psychosocial support is important because it is promote sense of safety, promoting connectedness, promoting the sense of self and collective efficacy, promoting calmness, promoting hope. Finally, it is one from the different researchers that is mixed by the scientists in the all over the world about COVID-19 and post-COVID-19. This figure shows that COVID-19 impact on mental health of Egyptian patients according the health condition vary from depression and anxiety, substance abuse, obsessive compulsive disorder, as arranging from different psychiatric disorder, and different between male and female. As we see, the male is one who liable to suffering from the different psychiatric disorder with high range than the female. So it is important to learn all people how deal with psychological disturbance or problem they have to avoid suffering from depression or anxiety or other disorders. Finally, studies and research must continue during the post-disease epidemic as well as after it is over to know all the psychological effects that can be overcome in order to protect the well-being of humanity. It is some resources, and thank you. Finally, protecting, promoting, and supporting of mental health, very important, and we of all need for it.